Oliphant.
Thank you, Chair, and thank you, committee members. I'm hoping that you experience today, as well as see what I believe is the best way that legislation should be both crafted and taken through the House of Commons in this collaborative effort. I want to thank my colleague. And, it's kind of one of those things about this new Parliament where I think that there should be and is gradually starting to be a collaborative way of working together. And so working with the member for Niagara Falls, Mr. Nicholson, has been a great treat. Senior member, former minister who knows the way things actually work and makes me look good. So I want to thank him.
Make sure that's part of the record.
Okay. You as the members of this committee have the chance to do the same thing as we are modeling for you today, is to work collaboratively to get a bill passed that has its roots in the New Democratic Party with Mr. Gravel and is continuing now with the other two parties in the House. And I think this committee has a chance to actually make history by having the first national disease strategy adopted by Parliament that we are not unaware that it could become a model for other diseases, and that there is a hunger for the federal government to play a leadership role, not encroaching upon any provincial powers to actually do the delivery of health care, but to provide an operation of collaboration and cooperation and best practices. I want to really begin by telling you the story of Ewart Angus. Ewart Angus was a member of the church that I was a minister for many years in Toronto. Ewart died, however, before I became the minister, and he left a sizable amount of money to the United Church of Canada. However, the United Church of Canada sort of lost track of that money and allowed it to grow over many years. And I discovered it in the late 1990s. It had reached $5 million, and it was earmarked for seniors' care in North Toronto. And nobody knew what to do with it. I did. And Ewart had been a member of our congregation, and we asked for the money to be transferred to that congregation to enact its vision of providing care for people with Alzheimer's and other dementias. We built Ewart Angus Homes on Merton Street in Toronto, really an amazing model for Alzheimer's care. What it does is it has 3 floors of market and subsidized rent apartments geared towards seniors, and then 2 floors of Alzheimer's care, meaning that if a couple, one of the members of the couple has dementia, that they can stay in their home while their spouse goes to a floor with secure and good medical care, which was originally for early Alzheimer's, mild stage, but is now progressed through to a medium and even a more advanced stage Alzheimer's. Being good fiscal conservatives, as I am sometimes, we actually ended up with $2 million left over at the end of that project after having built that building. So we built another one called Cedarhurst, which is in Don Valley West, coincidentally, and it provides another setting of 26 beds, 26 rooms for residential care, long-term care for people living with dementia. What it does is it's based on a model that we as a congregation discovered in Australia that Dr. Booth had developed, John Booth, where there was a relational care, small groups of people living with dementia, 5 at a time with 1 personal support worker, living in a residential setting and gradually developing a community that would honor the person. It continues to this day. I was at Ewart Angus Homes at Cedarhurst, the second campus, last week, and they are continuing to evolve and develop. The reason we need a national strategy is because that model of care is unfortunately almost unique in Canada in purpose-built, intentional housing for people with dementia and long-term care. It links with Sunnybrook Health Sciences Centre, with the University of Waterloo, and a variety of satellites. However, it's quite limited. What Mr. Nicholson's bill does is offers the possibility of taking best practices in a place like Ewart Angus and spreading it across the country. And it does that by capturing the attention of the Minister of Health, requiring her or him in the future to submit an annual report to Parliament. It fosters cooperation and collaboration through an advisory council, and it demands an updating to Canadians on how we are doing. It encourages increased funding for research, for clinical care, and for patient support, and for family support. And it does that in the way the federal government alone can do it, through the powers of convening, the powers of organizing, the powers of displaying exemplary forms of care and ensuring that we're able to spread that across the country. There may be gems of care I don't know about in Winnipeg or Vancouver or Cape Breton Island. I don't know where those models of care are. By having a collaborative approach, we will learn where those things are and be sure that we have that kind of cooperation, also bringing in best international practices. The bill, I think, is quite clever, and I think it's clever in that it draws attention to the issue. It requires the government to pay attention and report back to Canadians. It fosters, through an advisory group, that collaboration, and it begins to put some accountability into the government where Canadians are looking for it in this particular disease. I'm sure you've had drawn at your attention the report that was issued just last week or a week and a half ago in November, Dementia in Canada, from the Senate, committee co-chaired by my good friend and colleague Kenneth Ogilvie, as well as Senator Art Eggleton. It's really a very fine study on dementia. And what it calls for is a collaborative approach that brings what they're calling a Canadian partnership to address dementia. By having an advisory committee embedded in this legislation, we will actually be able to live out what the Senate, after a very thorough study, much more thorough than we've done in the House of Commons, would actually envision. I commend it to your attention and to take great care as you go through clause by clause that we don't lose the spirit of what the Senate has learned, that Canadians are looking for leadership, that we can provide that leadership by having such an advisory council, bringing together the best of both clinical and research, as well as social workers and family caregivers and those living with dementia. I'm just going to close by talking about an event I was at last week. The Alzheimer's Society of Toronto, a formidable force under the umbrella of the Alzheimer's Society of Canada and Alzheimer's Ontario, had a fundraiser, an amazingly successful fundraiser, with really the best dinner I've had at a fundraiser in my life. That's an aside. At that event, a woman with Alzheimer's made the keynote speech. She carefully and cautiously chose her words and moved me to tears as a person who is aware of her circumstances, is looking at what my former colleague Marion Ritchie called the long journey home, and gave me both the courage and empowered me to keep fighting this fight. I'm encouraging you to do the same, to make sure that we show Canadians that this Parliament takes this disease seriously and will take every step we can to make sure that we engage with those who know more than we do and make a difference in the world of Alzheimer's and other dementias. Thank you.